Malaria is a life-threatening disease that has remained a major public health challenge in Nigeria. World Health Organization statistics indicate that Nigeria alone accounts for 27% of all cases of malaria and 32% of global death toll from the disease. The statistics are quite worrisome, but already eliciting strong political commitments from leaders at all levels towards eliminating malaria in Nigeria. Today's episode of 30 Minutes will focus on Nigeria's renewed campaign to end malaria by 2030 and the role everyone has to play towards achieving the target. Welcome to the program. I am Mitaire Ikpen. Malaria is transmitted to humans who are exposed to bites of the female Anopheles mosquitoes that are infected with Plasmodium parasites, which cause malaria. Malaria remains one of the most common diseases prone to misdiagnosis and self-medication, as persons experiencing body aches or fever are quick to approach the nearest pharmacy for anti-malaria drugs without first conducting a test. Of course, health experts discourage that approach. Now, let's look at the factors that trigger malaria and the vulnerability of the populace, as revealed in our first report by Oluseye Adeagbo.
Garikri district is in the heart of the nation's capital city, Abuja, with busy and densely populated neighborhoods. In this highly developed area, in Phase 1 of the Federal Capital Territory, FCT, is the Enugu Strait. Malaria being an infection that predominantly spread in tropical climates, thriving in stagnant water where mosquito vector that carries the Plasmodium parasites can survive. Lifestyle factors and the state of the environment in Enugu Strait enhance the risks of malaria infection. Patients Ekele and Gami Sule are both mothers of two, though they make efforts to protect their children and families from malaria.
Me and the kids, we do cover ourselves with mosquito nets, but recently that one got spoiled, it got torn. So I've not been able to get one for the past 3 months. But normally, malaria do attack us, let me say 3 months interval because of the environment and all that. But I've been trying, if we go to primary health center, so we'll tell you that we need to go and buy. They don't give it to us for free. And us going to the pharmacy to get again, it's not all pharmacy that do sell mosquito nets.
We protect ourselves by sleeping in the mosquito nets. The malaria is not too disturbing them at any time because we used to take malaria drops. And after 3 months, we used to treat malaria.
The two believe there are others residing in the area who lack awareness on malaria prevention and seek intervention against the scourge.
They can, let me say, have a program once in a while, time to time, to sensitize people on how to keep your environment clean and sleep under mosquito nets. By doing that, they can now come to the locality like this to share the nets and then advise them how to use it.
While patients and Gami embrace the use of long-lasting insecticide-treated nets, Innocent Okegbe has his own observation on the use of mosquito nets by most homes in the neighborhood.
But this mosquito net, people coming to your house to look where they see the mosquitoes, they will begin to make insult on that. Says the man in a mosquito net put for a room for the parlor. So if in one room you go to use the mosquito coil, mosquito net, and people no go like to look you as responsible. That's why they don't use that mosquito. Yes, but for children, it is necessary that this mosquito net is used because, for example, you have one room now. If you have one room with about 3 children in that one room, you will see that the children, you can make small nets and then put them on the ground to sleep to prevent them from that. But it is not, so people will look at it as causing dirty or blocking some areas in the house. That's exactly what is happening. People don't care of that mosquito. Even though they bite themselves, they no care. So far, make it look like, say, your house they need.
The increasing trend of communicable and non-communicable diseases globally explains the interaction between health, disease, and poverty. Sub-Saharan Africa, including Nigeria, has recorded poor health indices over the years due to morbidity and mortality associated with childhood diseases, with malaria a great public health concern. World Health Organization (WHO's) report of 2021 shows that Nigeria alone accounts for 27% of all cases of malaria and 32% of deaths globally.
Malaria is seen as a traditional illness, disease here because, it's been here for some time, and everyone is at risk of malaria. And so the National Malaria Program has drawn up a strategy for malaria control with a clear goal and target to achieve, the reduction. And this stems from the use of preventive measures such as the use of long-lasting insecticidal nets, other vector control measures like indoor residual spraying, and chemoprevention. We also have prevention in special populations like in pregnant women through the intermittent preventive treatment in pregnancy and in children under 5.
These poor indicators has prompted key players in Nigeria's health sector to continue the war against the scourge with carefully selected foot soldiers trusted to deliver the desired results. A leader, Oniawa, has been using his Nation First Foundation, a non-governmental organization committed to the cause of the vulnerable, mostly women and children, to support Nigeria's efforts at reversing the trend of heavy malaria burden amongst the populace.
I'll tell you that the state of awareness now is poor. Because if we go to like areas we have gone to, the grassroots, we deal with the grassroots, you find out that our people don't even know, some of them don't even know the mosquito net. Sometimes we give to them, they get scared and say, hope we have not come to give them. But we'll now teach them, it will now come to the level of teaching them from level 1 to level 2, level 3 of how to use the mosquito net, spread it outside, wash it, then use it for your family to prevent malaria. But I would say that the state of awareness is very poor. We have to do better. We have to go downwards to those grassroots because if we cannot fight it from the ground, if we end malaria from Abuja now, for instance, what about my village? We need every one of us to come now and do better, because the stage at which Nigeria is now in the case of malaria, if we don't tackle it now, like if you go around residential houses, you see logs of water, you see these tires, the people just live. If we don't keep our environment clean, there's no way we can achieve this. So it starts from our homes. Like they say, charity begins at home. If we must end malaria in Nigeria, we must start fighting it from our homes. So we advise every stakeholder in this area to join hands together. Let's do it together, because it's something we must do together and we will achieve it. It's achievable.
A leader expressed concern over the increasing death toll from this preventable and curable disease, and he harps on strengthening coordinated efforts.
Whether you are part of the fight against malaria or not, you cannot run away from malaria. Malaria kills more than every other disease. It kills faster. As I am now, I've been battling malaria for the past 2 days. So I know what it is for someone to be faced with such problem. So it's not easy at all. It's not easy, mostly for those who don't even know what the symptoms of malaria are, who don't have access to health care. It's not just the government or the organizations like ours. We also commend all the NGOs that are stakeholders in this, even all the government agencies who also are in this area. We commend every one of them, but we need them to do better. We end malaria from Abuja now, for instance. What about my village? What about the rural area like the Niger Delta where I come from? I come from Delta State, where we are surrounded by water. And we know one of the fastest breed of mosquito is bad water, bad, dirty environment. So you see the message of this mosquito net is very essential at this time. And we need the government to make provisions, because we, as an organization, I must say this now, we buy mosquito nets to give to people. We buy malaria drugs, we buy everything we use to assist our people, because we feel nation building is not just a government thing, but a collective effort.
Control, for effective malaria control, it has to be through a combination of strategies. And the national program, through the help of, with recommendation from WHO, has designed the program and identified interventions that work. And for these interventions to work, they have to be accessible and affordable and available for everyone in need. So universal coverage of intervention for me is the most important area that we have to concentrate on. But aside those, you also have issue of funding. So when there isn't sufficient funding to support these interventions, of course, you know that this intervention will not be able to go around to the population in need. So it's important that all interventions, the mix of interventions, should be made available to all the citizens in need.
Despite the introduction of new interventions and the latest malaria vaccines, seasonal malaria prevention, as well as sleeping under long-lasting insecticide-treated mosquito nets, especially for pregnant mothers and children, will remain crucial to saving lives until total elimination of malaria is achieved.
Of course, Shaye, malaria infection can cause severe complications in pregnant women, leading to high rates of miscarriage. It is also responsible for a considerable proportion of infant mortality, with children under 5 years being the most vulnerable group. These are reasons behind the renewed commitment by government at all levels to significantly reduce the malaria burden in Nigeria, as we shall see in this next report by Thomas Mitaire.
The number of deaths, losses, and other challenges recorded and associated with malaria globally are enormous. This is why the World Health Organization, WHO, has set a global target of ending malaria by 2030. Since the 60s and the 70s, Nigeria has initiated several national policies and programs to tackle malaria.
Developing a strategic plan, working with our rollback malaria partners, to address the problem of malaria in Nigeria. Then we have rolled out about 4 strategic plans, and we are now in the 5th malaria strategic plan, which is meant to take us to parasite prevalence of less than 10% by 2025 and achieve a reduction in malaria deaths to less than 50 deaths per 1,000 live births by 2025.
As part of federal government efforts to combat malaria, President Muhammadu Buhari recently inaugurated the Nigeria End Malaria Council, made up of 16 members and headed by Africa's richest man, Aliko Dangote.
The additional advocacy and funding the Council will bring to the malaria control drive, we can anticipate a reduction in malaria burden that ensure that our children, pregnant women, indeed all Nigerians, are shielded from the disease. We must work together to reduce the unnecessary deaths attributable to malaria and ultimately improve the well-being of citizens.
The establishment of this council is a great opportunity to ensure sufficient funding to protect the progress made so far, sustain the progress, and be on an irreversible pathway to ending malaria for good.
What is important to note today is that malaria is preventable, treatable, and curable.
Malaria vaccine promises to be a game changer within the malaria intervention toolkit, and Nigeria is expected to lead effort in Africa toward development of the vaccine and meeting the required financing obligation.
The Council has the mandate to make the elimination of malaria a national priority.
Nigeria is trying to align with that global strategy so that we are also counted among those countries that are able to move towards pre-elimination by 2030. And so that is one of the reasons why we are trying to do things differently. Not that we haven't been doing well, but we need to accelerate progress towards achieving these targets that have been set. And part of this is the effort by the Mr. President that recently inaugurated the Nigeria End Malaria Council. And this council, which is chaired by Alhaji Dangote, is expected to be a council for resource mobilization, domestic resource mobilization, because we know that all the plans we have set out in the malaria strategic plan, there's a funding gap.
The council is expected to collaborate with states and local governments and other stakeholders in the private sector to create awareness on preventive measures, provide pharmaceutical and non-pharmaceutical solutions,
and by giving the chemotherapy to pregnant women as well as the seasonal chemotherapy we have just commenced, you are drastically reducing the level of parasite in the blood of our people. And even if they come in contact with the mosquito, the transmission is drastically reduced. And our target is that we hope to achieve 80% of 80% of all persons presenting to any of our hospital with any form of fever are getting promptly diagnosed. Once confirmed with malaria, are provided with the appropriate therapy, and once for any child that is also running fever is promptly diagnosed and then provided with the treatment. So with this, and of course, like earlier mentioned, you just have to carry along the people. They have to understand the importance of sleeping in the nets, of putting nets around their windows and doors, and ensuring their environments are cleared, any water collection is clean and removed.
Considering the prevalence of malaria cases during the wet season, preventive measures are being taken by state governments to protect local populations. State governments are also keen into the federal government's resolve towards ending malaria by the year 2030, in line with the vision of the World Health Organization.
We, in addition to our routine supply of anti-malaria commodities to all our 1,064 primary health centers and secondary health facilities, Kaduna State Government, in collaboration with its supporting partner, the Malaria Consortium, engage in distribution of prophylactic drugs called the SPAC, that's the sulfadoxine, pyrimethamine, and amodiaquine. It's a combination drug that is given to children within 3 to 59 months. We call them the special and the vulnerable group. So since they usually come down with cases of malaria during the rainy season, 4 cycles of administration of these drugs has been found to effectively reduce the incidences and prevalence of malaria amongst this age group. So we just concluded our end of cycle review meeting for cycle 3, and we hope to continue with cycle 4, that's next month.
We have malaria commodities both at testing level with rapid diagnostic kits for free, because it is now compulsory that all fevers must be tested before you can confirm whether it's actually malaria or not. Because it's not all fevers that can be due to malaria. There could be some other diseases that can present with fever. So it's now pertinent for everyone now to carry out tests before treatment. And those test materials, the rapid diagnostic kits, they are available across all our hospitals for free. And the medication, if positive, to treat malaria is also available in our hospitals for free.
The emergence of drug-resistant strains of malaria parasites is also compelling states to roll out the seasonal malaria chemoprevention administration, which consists of 4 days activities of going from house to house to administer malaria prevention drugs.
Then we also have other preventive measures like this seasonal malaria chemoprevention, in which we target children under 5 to give them drugs that will protect them during the rainy season, in the most part, 2/3 of the country now is now benefiting from that.
Awareness creation in the rural areas and availability of anti-malaria drug, especially in all primary healthcare centers, are described as crucial steps to complement the effort of the federal government in the fight against malaria.
This is why one of the key interventions is to look at this seasonal increase in the number of the parasite-carrying mosquitoes and to address the issues by providing long-lasting insecticide-treated nets for the pregnant woman and her children under 5 to sleep on, and at the same time target providing treatment to these particular vulnerable people, the pregnant women and also the children under 5. And clearly we are targeting how we can reduce the level of parasite in the blood of these people. And by that, even if there is contact with the mosquito, the level of parasite in the blood is so low that it will not be transmitted from here to here. And I can vouch for you, as you know, the FCT is on its own when it comes to ensuring that things are done properly with the environment.
We were able to go into the households and distributed a lot of nets to the various members of the household. Especially we concentrated mainly on the those at risk. Those are the pregnant women and the under 5. But it was a universal net distribution exercise. Everybody was taken into consideration. But those people at more risk are more considered more. Then also the state government has a policy of giving nets to children under 5 in their when they come for their child welfare clinic, immunization, and for every child that has really completed immunization is entitled to nets. Then all pregnant women who come and register in our various institutions are given nets free.
Health experts believe that beyond the effort of government at all levels, citizens also have a role to play in prevention and elimination of malaria.
So we should make the conscious effort as good citizens of the FCT to be aware, and specifically for malaria, that once you have a good and clean environment, once you are conscious of the fact that it's good for you and your children, your pregnant women to sleep on long-lasting treated insecticide nets, and make sure as soon as there is any evidence of fever amongst any member of the family, you promptly go to the hospital where you are provided with a quick diagnosis to confirm that it is malaria, and we can assure you that there are standard medications recommended by the World Health Organization available for these your members of your family or yourself to be treated promptly and properly.
It is believed that the death toll from malaria could affect the GDP of a nation negatively, especially every time citizens of working class are brought down by the disease.
Over 50 million cases each year are recorded, and this translates to economic losses for the country, absenteeism from work, parents having to stay home caring for their children who are sick can't go to work, and of course out-of-pocket expenses. So all this reduce economic viability of the population.
This underscores the fact that health is wealth, and all necessary measures must be taken towards eliminating malaria in Nigeria.
Indeed, Thomas, health is wealth, and everyone's role is critical towards eliminating malaria and safeguarding public health. That brings us to the end of today's episode of the program. Do well to follow the tips for malaria prevention in your household and locality. Till we bring you another interesting episode of 30 Minutes, I am Mitaire Ikpen. Thanks for watching and see you next time.